I have to say, salaries are low in South Carolina, but we do have a state health plan that we pay for, and we do have state retirement. So we're very fortunate in that we both have a pension from the state, we both have health insurance, we now have Medicare, and I've had several serious surgeries, very serious surgeries, and between Medicare and the state health plan, we would be bankrupt if we hadn't had those. And, you know, I'm very well aware of how fortunate we've been. We also were personal savers, though. We do not just depend on Social Security and the state pension, because the state pension isn't that large.
Correct.
So we've lived a bit frugally all of our lives, and as a result, we also have personal savings. We have a 28-year-old daughter who currently has a pension plan. We don't know for how much longer. Currently does have health insurance, and we're thankful for that. But we worry about her future, because I understand, and I've read about it for years, about the fact that as the whole system gets more and more top-heavy, there are less and less people to put into it to maintain the top-heavy system, and I'm very well aware of it. All of us have a responsibility to think about others and not just ourselves, and it is easy, as being at the tail of the caboose, so to speak, to think of ourselves, because it gives us the opportunity to be here from South Carolina, for example. On the other hand, everyone's going to have to take some cuts somewhere. It's just not possible otherwise to solve the problem. Now, where the cuts are going to be, I don't know. But the obvious ones seem to be raise the retirement age, somehow lower the benefits, put more emphasis in a true governmental campaign sense on personal savings. In many cases, people on minimum wage or just above minimum wage are really below the poverty line, and it's unrealistic to say you have to take personal responsibility for your retirement when really you need to be taking personal responsibility for putting food on the table that night as best you can. So there's another part of the whole equation, which is we've got a significant portion, particularly kids today, who are having, the recent college graduates who are having trouble getting jobs. Pensions would be nice, but health care insurance is the prime thing they look for, and they're so young they don't think about retirement savings, and nor can they. I mean, they only have so much money, and I am very, very concerned, and this is going to be a little bit political. I am extremely concerned about the difference between the lowest paid and the highest paid in our society. We were a society a number of years ago in which there was not such a huge pay differential, and the majority of the U.S. was middle class. New York City now has a higher differential in pay than Guatemala does. That is, a higher differential in economic levels than Guatemala. If you know anything about Central American history, you know that part of Guatemalan history has been ugly. And it frightens me when we have a growing lower class, a shrinking middle class, and then a very, very wealthy upper class. Because in the sense, yes, the system has failed, but it's not the system of Social Security and so on, it's the system of taxes and how we have taxed people that allow so much wealth to be concentrated in so few hands. In fact, someone we know in Charleston is working with one leg and one prosthesis, is working full-time on his feet at McDonald's because he can't retire, because he was a painter and didn't have any kind of retirement fund. And so there he is on his feet 40 hours a week, working for somebody who's 25.